So please join me in welcoming Mrs. Garrett. Go ahead and stand up here so that I can see some of you folks over here. I'm very pleased to be here. I'm very pleased to be the moderator of such a great group of people. If you read the bios of these folks, you would see that I'd be up here for the next 5 hours. And also, you gave me the hardest names to pronounce and words to pronounce. So I'm going to do the best I can, and please bear with me. I apologize. The Reverend Bishop Daniel Turley of Chulucanas, Peru, is a virtual celebrity in northern Peru. His pastoral presence combined with a lifetime of service have made him very much loved by his people. And I actually did read about you, and I think that that goes around the world. Originally from Chicago, he was ordained a priest in 1968 with the Midwest province of Augustinians. Just after his ordination, he joined the first group of American Augustinian missionaries in Peru. In 1996, he was named the coadjutor bishop of Chulucanas by Pope John Paul, and then bishop when Bishop McNabb, the first bishop, resigned in 2000. He is loved and regarded by his people as a peacemaker and promoter of the rights of all people. In 2011, he was awarded the Peace Prize by the Peruvian government, Ministry for Women's Rights and Social Development. Bishop Turley will give a brief overview of primary care and health promotion in Chulucanas, Peru. I'm going to go ahead and introduce all the others so that I give them plenty of time between. Professor Karen McKenna, good Irish young lady, coordinator of the Connolly de Villiers International Field Placements and a graduate of the BSM and MSN programs in the college, has worked as a faculty member at Villanova's College of Nursing for over 25 years. With a special interest in health promotions, she has accompanied Villanova students to Peru for the past 10 years. For those of you who are my generation, it was really nice sitting at her table last night because we remembered a number of great times at Good Counsel. For those of you students who are all over campus, we talked about candidates, we talked about all kinds of wonderful academic adventures while living here on campus. But it was really nice catching up on all the outside activities. Sarah Iverson graduated from the BSN program in May 2008, went to Chulucanas as part of the health promotion experience in her health promotion course. After graduation, she worked at the #1 hospital, the Johns Hopkins Hospital Children's Center, and presently works at the Children's Hospital of Philadelphia. Brooke Betts is a 2012 graduate of Villanova's BSN program, made several service trips, one to Jamaica, to Chulucanas as a campus ministry community health student. Her interest for working with peoples of other countries was sparked in high school when she went to Bolivia and Peru with medical missions. She now, too, works at the Children's Hospital of Philadelphia. Thank you, and welcome to this group.
I'd like to begin by thanking Dean Fitzpatrick for inviting me to be part of the 60th anniversary celebration. I don't know how to thank you. It's a great privilege to be here at this moment. And it took me 2 days to get here. They were great. And I have the great respect for the School of Nursing, Villanova School of Nursing. And for the past 12 years, every year, the School of Nursing has been coming to our diocese of Chulucanas. And so the few words that I am going to share with you will come from the bottom of my heart. And it's a privilege to be here to listen to Dr. Francis Scuti. I thought the presentation, I didn't listen to everything because I didn't get here on time, but the part that I heard was magnificent. I just thought, what a privilege to be able to be here with you, to listen to your wisdom, to your experience, and at this moment, I think, what a wonderful wisdom sharing you gave us. And I'm just going to refer to a magazine called Villanova Magazine, Fall 2012. And I have to ask Dean Fitzpatrick, please forgive me. I really don't know anything about primary care. I don't know much about primary care at all, because we're supposed to be talking about care. And forgive me if I don't talk about primary care. What I'm going to talk about is, I think, a little bit what the doctor was telling us just now with his wisdom, his energized talk that he just gave to us, is that the smile in this magazine of the Villanova nurses, the smile in these pages with the children, and one of the young nurses saying when they were leaving, visiting the abandoned children, the little children who have been abandoned by their parents because of poverty, and the little child grabbing her leg and holding on and not wanting to leave her to leave, and the feeling is going through the nurse, the young nurse, and the feeling in the child because the bonding, and because this child needs affection, and what doctor said, love, craving for someone to love, and something has been ignited in that little child's soul and spirit, and also in the nurse, also in her spirit, because she feels that she's sharing her love with someone, and she's so happy to do that. And that's all written all over the faces of the little children in the magazine, and in the faces of the Villanova nurses who, as one doctor told us on a medical campaign, he was from India, and he is a specialist. I forget his name now because it's several years back. He began to cry. He's, I would say, in his late 40s, early 50s, and he began to cry, and he said, this is what I became a doctor for. He's a plastic surgeon. And he has said, I didn't become a doctor really to help women become more beautiful by changing their noses or ears and whatever. He said, I became a doctor because I wanted to help people who have the cleft lip and who have a cleft foot and have so many other difficulties. And he began to cry because I'm doing what I really wanted to do. And he said, my whole career has come to life here, come to life with the poor in Peru. And so that's what I find in the Villanova magazine, in the School of Nursing. I think the nurses have shared with me when I've been there, and I think they've said this very same thing that I've said to myself thousands of times, because I've been out of the United States since 1965. I was 4 years in Mexico and 44 years in Peru. So I always feel like I always receive more than I can give. So I never feel like I've really given of myself, because I feel so selfish that I always receive more than I can ever give to the people. I'll just give one example of that. I was celebrating the Eucharist, our main celebration of our Catholic faith, and there's a procession with people come up with the gifts, and the people came up with their gifts, potatoes and wheat and different gifts that they were giving. And then there was this little lady, doubled over, who started coming up the aisle. And so I waited for her, and she finally approached me, and I would think that she would be in her late 80s, or a very elderly lady. And I remember where she was living, because she lives in a little hut outside of the town, and she lives by herself. Her house is about, well, I don't know, about 10 feet by 10 feet. Just a tiny little house, a mud floor, mud walls, a little tin roof, no stove, little adobe bricks, and she cooks on that with one little pot. She has no furniture. She has a sheepskin as her bed. This lady's in utter poverty, and she came up, and I saw her, and oh. And she had this little dirty old handkerchief, all with little knots on it, and inside the handkerchief there were 6 eggs. Wow. And I said something to her that I had to begin to cry, because I said, please lady, I said, you need this food, you have nothing. And she looked up at my face and she said, please don't don't take this joy away from me. I want this to be given to God. And I said, I won't take your joy away. You want to give this to God. I have to receive this with great love. And the whole message of Jesus Christ and of the Catholic, our Christian faith, of the gospel, just came to life at that moment. The whole gospel. I never learned it at a theology course in a university or from any teacher. She taught me more at that moment because she was that example of the wealthy person who went in and gave money to the temple, and then the little widow came in and she gave 2 cents. And as Jesus said, you know, which one pleased God more? And the answer was the poor widow, because she gave everything that she had, and the wealthy person that was very happy to be giving this was giving what was extra, what was left over, and she was giving everything. And this lady was giving everything. She has no food, she has nothing, but she was so happy. She was so happy. She was so happy to give this. How could I take away the happiness? And that's why I think the nurses, the learning, it says here, living and learning in Peru. And I think what Dr. Just said was the volunteering. That if we want to be happy, volunteer. Don't keep going inside of ourselves and closing off doors, closing ourselves off from this world that's so complicated and difficult. We just close ourselves more and more in and in and in. And I would say the answer is open ourselves up. There's so much goodness. There's so many things in our people of Peru. They're so beautiful. And when we open ourselves up to the poor, and like the nurses are doing, and the beautiful nurses from the School of Nursing, the people, when they see them, it's like God has come. The expectations are great because they just think these nurses are coming from so far away. Why would they be coming to see us? And the people are so thankful because these young nurses have come. They don't know where Villanova is. They really don't know where it is. But they do know that it's a special place, that they're beautiful people at Villanova. They don't know where it is. They don't know what it is. They just know it's a beautiful, has to be a beautiful place because the nurses are beautiful. And they have big smiles. And they are so joyful. And they're so sharing. And they're so wonderful. And the people are just so grateful. But the nurses receive at least as much, and I think much more than they give. And I think that learning and living and that sharing is so beautiful of the School of Nursing. And I just praise Dean Fitzpatrick and Karen and all of you for all that you're doing in your outreach. And I would just say continue to outreach, continue to. It's expensive, it's a sacrifice, it's a problem, it's not easy to go out. But I think it's really worth the investment. And I think it has a lot to do with primary care, even though I don't know anything about primary care. I think it has a lot to do. Thank you very much.
The university had filmed last year in Chilcanos where the students went for their week, their spring break. So the film crew came and filmed our home visits, filmed our teaching presentations, and filmed the community. And you'll see a good picture, I think, of the community and some of the work that the students do here.
The other nurses and I prepared for 3 months and traveled almost 22 hours to get to Peru. But getting here was the easy part.
Just driving into the town, you see all the work that needs to be done. We're here to provide service, and it's basically Villanova's mission. They lack the resources to treat their condition. They are in need of more health education, and that's why we're here. The education that we can give them from these presentations is a lot more permanent.
A trip like this prepares us to be culturally aware and socially responsible people.
Okay, today you're going to be doing your home visits. Everybody knows who they're going with and who their group is, right?
It's completely different to go into someone's home than to see them in a patient in a hospital because you're brought to their element, you're brought into their world. Our patient was an elderly man who had been deaf and mute from birth, and he had diabetes and was losing his vision because of diabetes. Communicating with that kind of patient is difficult. Spanish, English wasn't even an option, and if one of the sensations he's left with is touch, then that's what I have to use. Nursing is more than just health, and it's more than just knowledge of medicine. Being able to care for them, but also give them the emotional support that they don't have.
You know, when you're in the moment, we're smart, we're trained, we know what to do. It's easy to try and focus on what needs to be done, but there is an emotional aspect. It's something that never really goes away. But it also shows that we're really needed and that there's a reason we're here. That's a really great part of this trip, and I think our school in general, is because we're really good about leaning on each other as nursing students. And anytime that one of us got nervous or wasn't sure what to say or do, we knew that we were all in the same boat and we were there to help each other. Being a nurse to me is kind of a gift you have. In some circumstances, it's easy to feel, you know, helpless. And like, you know, when you're waiting for an ambulance, you're waiting until someone comes and they can fix it and take it away, but that's when our job starts. Our job starts when it's hard.
For me, this gave me a new perspective on what people really need from nurses and in what ways nurses can provide health care to people who don't even have a lot of resources. Having that experience of being able to think about our lives of simple living and spirituality and community, that's really unique to this experience alone.
I can make a difference and I can impact the lives of these people, and I think that's really important.
Maybe we won't move to Chilicanas, maybe we won't have $1 million to donate someday, but if we keep our eyes open and we keep listening and we keep learning about the culture here and our experience, if we can bring that with us, we can make a change anywhere.
So that gives you a kind of a picture of the community and some of the work that the students do during the week that we're there. Can you hear me? Is that better? Yes. Just to give you a little history about how we connected with Chilicanas and how this whole process has begun and been carried forward since 1999, actually, was the first year that we went. Father Jacopici, an Augustinian, had lived in Chilicanas since the 60s. And he came back to Villanova and connected with Dean Fitzpatrick. And the two of them decided that this was a community that would provide many opportunities for the nursing students. Would give them an opportunity to experience a different culture, to look at global health, and to put the university's mission into practice. So we started off that very first year not quite knowing exactly what we were going to do. Barbara Ott, Professor Ott and I were the first two faculty that took a group of students. And we had a lot of meetings the first trip. We met with various groups. And the one group that sort of formed what we have done ever since is a group of health promoters. These are lay volunteers who donate their time to work with their parish members trying to improve their health. And that first year, they said to Dr. Ott and I, would it be possible for them to take groups of students out and do home visits so that they could meet some of the people in the parishes who had health problems? Could they then teach the patient, teach the family, and teach the health promoter how to take better care of them? And Dr. Ott and I looked at each other, took a deep breath, and said, okay, we'll try it. And we did. And that has become our model in Chilicanas. Every morning that we're there, the students go out with health promoters, an interpreter, a nurse from American faculty or somebody else who's with us. And we do home visits. Mostly teaching and validating what the families are already doing, teaching the health promoters, working with them to improve the care of the sick people that we see. And then at the very end of the day, after their siesta time, the students do teaching programs with the community. A lot of health promoters, but actual members of the community also. And that has been the model that we have fine-tuned and sort of expanded over the last 14 years that we've been going. So that just gives you a little bit of the history. We could never have done any of this, of course, without the tremendous support of Bishop Turk. And his motto with us has been that we could come and maybe build a building, start a foundation for a home or a church, and that would last a while. But the education that you give to somebody never goes away, and that gets passed down to generations after generation. So through this support, and of course we supported the College of Nursing and Dean Fitzpatrick, it has been an ongoing and very successful program. At this point, I think we'll hear from our 2 alumni about their experiences there.
Good morning. The first time I went to Chulacanas was actually as a campus ministry volunteer my junior year, and I was allowed to follow the senior nursing students to their home visits for one day. And I was so inspired by watching these students. I remember we were in one home in particular, and it was a mother who was concerned about the health of her 2-month-old baby. And I remember watching this senior nursing student who was talking with the mom, listening to her story, educating her, and reassuring her that she was doing the right care for her child. And it was something that I really hadn't seen in any other clinical experience. So I went back to Peru as a senior nursing student because I was so touched by the students and their home visits. But when I returned as a senior, after we had done more research on health promotion in other countries and education, I was excited to do the home visit part, but also really looking forward to educating in health promotion as well. So on our first day last year, we met with the health promoters in Chulacanas and asked them what they thought were the most prevalent health issues in the country, in the community. We were told diabetes, high blood pressure, high cholesterol, heart attacks, and respiratory infections in children, all of which are to some degree preventable. There were also misconceptions about disease. For example, one of the topics that we taught on was tuberculosis. And the people in Chulacanas told us during this presentation that TB was seen as a punishment from God or an embarrassment. And this prevented many people from being tested for it, understandably. We were also told that if someone was to test positive for TB, then they would be completely isolated from the community. When our students explained how the disease is transmitted, how you can properly control respiratory infection and control your respiratory secretions, and how if you did this, it was not necessary to completely isolate somebody from the community, the audience was very surprised and had a lot more questions for us. And as you can imagine, if this kind of education was spread throughout the community, it could really have an impact on the life of somebody living with active TB in Chulacanas, as well as impact the further spread of the disease. The problem is that this teaching needs to continue. In public health, behavioral changes frequently take a generation or about 20 years. Apart from our presentation, when we were visiting the homes to provide direct care, we also saw some of the issues that they had discussed and began to form a clearer picture of why these diseases were so difficult to manage. For example, most of the population with diabetes, one of the problems that they said was prevalent, didn't have access to glucometers to measure their blood sugar. And even if they were able to have access to insulin, they wouldn't have any way to refrigerate it or to keep it cool. So the way that we could help this population manage their disease was through health promotion and teaching healthy lifestyles. We talked a lot about exercise. So for them, feasibly, they could maybe go for a walk with their families after dinner every night, or lots of the women in our home visits told us they like dancing. We talked a lot about ways that they could feasibly do exercise that would work for them. We also discussed nutrition, how to properly balance meals. Proteins and vegetables weren't always easy to obtain, so we used local available foods as examples. We can't manage all of these diseases with the same resources and medications that we would in the United States, but we can promote healthy lifestyles, reinforce ways to prevent disease, and dispel these health misconceptions. Although health problems remain in Chulacanas, there's also a commitment to improvement. The health promoters, who are the volunteers, are very dedicated to their community and to the well-being of the future generations. And during our home visits, we saw that often it was families and neighbors who were the ones to come together to support each other through diseases. During our presentations, I was very touched by how many people had traveled to listen to us, were very interested in asking questions and listening, trying to better their community and bring more knowledge to their loved ones at home. Their devotion to each other as a community, as well as their trust in us as students, was very humbling. And so in preparing for this panel, I read through the journal that I kept while in Chilicanas. And after our first day, I had written, "I wish I was a wizard or a surgeon and could just fix some of these problems. I feel like all I have to offer is advice and Tylenol." I was wrong, but I wrote that after our first day at a diabetic clinic, and we would see many people with blood sugars in the 300 to 500 range, which is extremely high. After seeing so many people with uncontrolled diabetes, I will never forget the very next day after I wrote that, we met a man named Alejandro, and he was at the clinic to have his blood sugar tested. And he told me that he had listened to the student's presentation years before, and he was knowledgeable about his disease. And he said he was very proud of himself because he has been eating right even though it's hard, and he's been exercising, and his blood sugar was in a healthy range because he had been educated and he had the motivation to change his lifestyle. And that was very important to me because it showed me that our education really can fix some of these problems, and health promotion is a real concrete way to help people manage these diseases. These things that seem so difficult to fix, especially when you're from the United States and you're used to treating things with medications, it was really meaningful to me that this education could impact his life so much that his blood sugar was in the 300s range. It was actually in a healthy range for him. And it was a realization for me because I may not move back to Chilicanas, or I may not be able to buy everybody a glucometer, but if we continue this education and this promotion and teaching them healthy lifestyle, it really can make a huge difference for these patients and their worlds with their resources. So this perspective can influence your career as a bedside nurse, and speaking to the prospective students especially. Not everybody will seek a career in international nursing, but it may open your eyes to a different population and a different way to view yourself as a nurse, not as an educator for your community. You will have patients from different countries with different support systems and special learning needs. And what you're learning in school may be brand new information to somebody from a different background. For example, one of the topics that we discussed when I was there was self-esteem and bullying and stress, which is a topic that we hadn't previously covered as nursing students in Chilicanas. And I remember before going, not really thinking too much of the topic, but we talked a lot about bullying in our schools, and it's a discussion we're familiar with, as you know, in the United States. And I remember just being so surprised with the response of the audience. People were in tears. They were talking about their children and bullying in schools and how low self-esteem can impact them their entire lives, and how it's not really discussed in Chilicanas. And it was so important for them to have a way to discuss this and to talk to their children and help with this problem. And it was actually so popular that it was requested later in the week. I hadn't really considered how different that information may be to somebody with a different background. So keeping that cultural awareness and having the tools to educate and support families with limited resources will always be a part of your career as a nurse. By considering the world that they live in, where they come from, and the resources that they have at home, you can make a significant impact on them, as well as the way that they will continue to care for themselves after they're finished with your care. At the end of this experience, the last sentence in my journal was, "I have never been prouder to be a nurse. I have so much hope for our future and the next group of students. I am saddened by what we can't change, but I am so inspired by what we can change." The future students who take part in this experience are part of a legacy. And not only will they have an impact on the people of Chilicanas and continue to bring health promotion to them, but they will be just as inspired as what they learned there. This program is doing much more than reaching out to another community. We are training future nurses to see nursing through the lens of global health.
Thank you, Brooke. That was a very good synopsis of the experience in Chilicanas. I'm going to briefly touch on my experience in Chilicanas about 5 years ago and kind of transition into how you can implement it into your career as you move forward. I think a little closer? Yeah. So my experience in Chilicanas was about taking your nursing assessment skills and applying them to a specific scenario. Much like Brooke said, you ask yourself, what are the health issues, what are the needs, and where are the gaps? In Chilicanas, the gap is in health promotion and health education. I've never encountered a group so eager to learn and to improve. It's very invigorating to be able to provide meaningful education for a group that is hanging on your every word. In addition, there is a more fundamental and human need to feel valued and to feel a part of a community. We can do this through health promotion and by placing value on their lives and teaching them to care for their own bodies. These types of changes require time, commitment, knowledge, and relationships. Villanova, through the dedication of Bishop Turley and Professor McKenna, has been able to nurture these relationships and provide sustainable health interventions. The importance of creating real working relationships should never be overlooked when the aim is health promotion. My Chulacanas trip changed my perspective on global health and health promotion in a way that directly affects my career to this day. The experience is unique because it allows you to take a big thing like global health and really break it down. In a fast-paced world with iPhones and iPads and robot vacuum cleaners, it can be hard to believe that relationships and education are the barriers to health for our most impoverished population. When you identify that this is the gap, it becomes a much more approachable subject. Suddenly, instead of talking about the daunting issue of global health, you find yourself most concerned with relating to the specific community you are trying to help and identifying the prominent issues within their community and developing culturally appropriate ways to handle them. This skill that we learned in Chulacanas is transferable. So, you're a student nurse, and you've had global health experience, and now you're back in the US at your first nursing job. Congratulations. You have a head start on cultural sensitivity and health promotion. You will be the first on the medical team to recognize my patient's reading level is not adequate for the teaching material that we've provided him. You will drastically change that patient's outcome by providing appropriate education prior to discharge. Your heightened awareness around health promotion is indispensable. You will be on the lookout for ways to learn more about the population you are working with and the health issues that concern them. Your eyes will be open to opportunities, both here and abroad, to continue to grow your skills in nursing education. I've been fortunate enough to pilot a children's nutrition and fitness program at a local homeless shelter that is associated with my hospital. The skills I developed working with the community in Chulacanas are directly applied to working with the community here in Philadelphia. Again, it's about assessing the needs, establishing relationships, working with the community, and finding the most effective ways to deliver that education. And again, I learned to never underestimate the power of building self-esteem and nurturing that fundamental need to feel valued for the children that we were working with. I can say without hesitation that my work with this program has been some of the most intense and some of the most gratifying in my career thus far. I'm grateful to my experience in Peru for igniting this passion to continue health promotion in my nursing career. Experiences like Chulacanas have the capability to change your perspective. Let them. I think you will find yourself finding and creating opportunities to grow your passion. Global Health is not interested in reinventing the wheel. Rather, it provides a means to take your Villanova education and share it within a community, with your knowledge, your compassion, your patience, and giving of yourself. In my experience in global health, I am greatly humbled by the community I was privileged to work with. Much like Bishop Turley was saying, I went into the experience expecting to bring knowledge and education to the people of Chulacanas. What I did not expect is what I got in return. The community taught me so much about health promotion and the basic health needs of people. The one Chulacanas experience that stood out the most for me was a home visit with a particularly close-knit family. The young man in the household was maybe in his 20s, and he had been diagnosed with AIDS. His sister was very knowledgeable about the disease process and was taking impeccable care of him. This did not change the fact that he and his family were fearful and unsure of some of the facts versus myths surrounding AIDS. A small group of us spent the afternoon being with this family and helping to share information and reassure them that they were doing a great job of caring for their loved one. It was heartbreaking to learn that the young man had been fretting over whether he was spreading AIDS via insect bites and other myths about AIDS. Knowing that we were able to put his mind at ease with just a little bit of education was very rewarding. I remember walking out of this family's home and feeling that nurses really do hold great potential in the field of health promotion. The ability to make a difference is there if we choose to embrace it. There is a famous quote by Isaac Newton that goes, "If I have seen further, it is by standing on the shoulders of giants." The average person in Peru stands 5 foot 4 inches, but I will always consider them my giants. They have inspired me to learn and continue to use health promotion in my career. Nurses are uniquely situated to be at the forefront of health promotion. Your BSN education provides you with all of the skills and knowledge to assess, analyze, create, and implement health interventions in any community that you encounter. In addition to improving people's health, I think you will find the process very rewarding.
I think the success of the program at Chillicothe, you can see. And it's not just starting with Barbara Ott and I, but there have been many faculty who have gone there and worked with students. Dr. Keach, Professor Mariani came this year, Dr. Levy, Debbie Wimmer, one of our nurse practitioner faculty, have been there. And so all of us have contributed, I think, to the success of it, and the students who have gone and have taken away as much as they have. This past year, we had 3 alumni. This past month, we had 3 alumni who volunteered to come with us as RNs, gave a week of their time, paid for their own way, to come and work with the community. Because the community has given them so much, and they wanted to give back again. And there's some alumni who came today, and they've said to me they're going next year. So we'll see, we hope.
So we have about 3 minutes left. And so, part of my job here is to ask difficult questions. And you've talked a lot about your experience and how it changed your perspective on healthcare and the priorities, which I certainly think can be embraced in inner city Philadelphia as well as certainly in Peru. So how did your experience relate to the mission of Villanova? Oops.
Sure, yeah. Villanova, big part of Villanova's mission is combining knowledge and love. So we were using our clinical assessments, we were using our skills. We were also a source of love and respect and appreciation for the community that we were a part of. And that was definitely a big part of my education in Chillicothe as well.
Thank you. Do you want to say anything?
Yeah, I think Brooke kind of hit on that, but the integration of knowledge and love, this is the focus of the previous presentation as well, is really the integral component for working with populations. So I think that it's the relationship building and being able to really connect with people that makes a difference in the end.
Thank you. And thank you for your service. Thank you.
We have a 15-minute break now.